Thank you so much for tuning in. Again, this is Dr. Kimberly Evans from Sugarland Med Spa, also known as the Vaginal Whisperer MD. Today I wanted to talk to you about a topic that has been plaguing me, that I've been wanting to talk about. I feel like the reason why I'm doing this is because I see a lot of women, we have all these women's issues, and sometimes we may think that we're the only ones, but the thing is that I want to let you know that you're actually not the only one. So this is something that I've heard women suffer from that I wanted to talk about today, and that topic is vaginal atrophy. So some of you have never heard of that, some of you have heard of it, and you've been like, well, what is that exactly? What can I do for treatment? What does it mean? All that jazz like this. So I'm here to tell you, first of all, it's something that's important to know about, because no matter what age you are, usually, even if you're young, eventually you're going to have problems with vaginal atrophy as you get older. The whole thing, or the underlying reason why we get this problem, is that we have a lack of estrogen. And as our ovaries fail as we get older, this is something that can occur. So things such as vaginal dryness, vaginal itching, uncomfortable having intercourse, bleeding after intercourse. Some of the ladies that I see, their tissue can actually rip and tear as a result of having intercourse. And unless you have like a good gynecologist on your side to look down there and say, hey, this is what's going on and these are our treatment options, then I certainly don't want you to be out of luck. So this is what gynecologists do all the time. This is what we're here for. We're definitely here to help you. But I did want to let you know that there's many different treatment modalities that you can do. There's some things that are tried and true, they've been around for a long time, and then there's some things that are just coming on the horizon, Since this is more of an impromptu thing, I certainly can't list like all the 100 different things that are out there, but I just want to give you some broad strokes just so that you know that A, you're not alone, and B, there's something that you can do. So because of the problem with the decrease in estrogen, the first thing you can do is figure out a way to increase your estrogen. Now, if you're kind of perimenopausal or postmenopausal and having these symptoms, again, there's not too much that you can do besides do some sort of exogenous estrogen or get estrogen from a different source. So those sources can be things like creams. They can be things such as oral tablets. They can be things such as vaginal suppositories. Those are things that are the tried and true methods that are on the market, and it's been on the market for a long time. There's also some other things that are in the market that are made from a testosterone source that then breaks down to a little bit of estrogen to help rejuvenate that tissue too. There is non-hormonal things that are available too. So I have some ladies that they can't do estrogen therapy. So what we do is we would recommend moisturizers. So anything from, KY lubrication, Astroglide, for lubrication, things like other oils, like some people, they may like coconut oil as a lubricant or different things like that. It really depends on what you feel comfortable with and what's your body, what's good for your body. And that, again, that just adds moisture. It won't necessarily rejuvenate the tissue, but it's definitely something that can keep the area healthy. I was thinking to myself this morning, about how hard it is to be a lady. Basically we have like a whole ecosystem down there to worry about. So for any reason, anything that can throw off that ecosystem, such as not having enough estrogen, certainly having any sort of infection or anything like that, it's tough to be a girl. So by keeping our lady parts happy, this is what will keep us happy down there for like the long run. Because I meet people all the time, and sometimes they can't have sex anymore with their longtime spouse just because they're so uncomfortable in this area. So I mentioned estrogen therapy, I mentioned vaginal moisturizers. The next thing, and I have a cheat sheet here to tell you about, I already mentioned over-the-counter things. There's a wide spectrum of things such as alternative medicines to deal with. The alternative medicines can be anything that's like herbal related, or there's even some studies now going on about how you can use like CBD oil to help you in that area. I certainly don't condone it. I don't have any dosages or anything like that to help you, but that's one of the other things that can help. Aside from medicine and herbal treatments or alternative medicine, you can also consider doing things like energy-based devices, and this is something that's also awesome. It's on the horizon. There is lots of data and lots of studies on this. So we use radio frequency, we use UltraFem 360. You can also use laser devices. One of the reasons why I like the UltraFem 360 is because although it is radio frequency, it's something that, in my opinion, has a lot less likely chance of leading to vaginal burns and things like that, just because the energy is a little bit nicer for your tissue. It's a little bit lighter for your tissue. It still heats up the tissue, and that's how both energies work. But then again, in my experience, I just haven't had those same issues as some people do with the lasers per se. But the key thing where you want to start off with all of this stuff is that, you want to start off with your good exam that's done by a gynecologist. They want to examine the tissue, make sure that there's nothing other obviously wrong. I mean, certainly, things like melanomas, things like vaginal cancers, those things can be missed if you're not used to seeing them. So after having that exam, then you can go into what therapies is best, for you, how to tailor your treatments just so that you're the most happy. So, those are just kind of the nuts and bolts. Later on, I'll go into like more detail about each of those a little bit more specifically, but I just want to give you some broad strokes, like to let you know, hey, you're not alone. B, there's something that you can do about it. And, we're definitely here to help you. Again, this is Dr. Kimberly Evans at SugarlandMedSpa.com, also known as the Vaginal Whisperer MD. Thanks so much for tuning in. Take care.